Now, it's the Southern African Development Community Malaria Day today, being the 6th of November. This is a day that aims to create awareness about malaria and mobilize the community to participate in malaria control programs. According to the World Health Organization, there were approximately 247 million malaria cases globally in 2021, with a disproportionately large burden of malaria on the African continent. But to paint a picture of the SADC region and efforts to fight this deadly disease, I'm now joined by the National Health Department spokesperson, Foster Mohale. And Tate Mohale, good afternoon. Welcome to today, and thank you very much for your time. We had a report earlier on ENCA that I think at least 10 people have died of malaria here in Gauteng since January to September this year. So it is a reality, but there are other African countries, especially in our region, the likes of Zimbabwe, Mozambique, and Malawi and others, who face a big burden of malaria. How big is it a problem currently in our SADC region?
Good afternoon to you, Tate Den, and good afternoon to your viewers at home. Yes, indeed, as the Department of Health or as government, we've joined the global community today to raise awareness about malaria, especially in the SADC, in order to encourage people, especially those who experience malaria symptoms, not to waste time, but to go to the nearest health facility, but also encourage those who are traveling to high malaria risk areas or countries to take extra precautionary measures. In terms of death, we can confirm that since the beginning of the year until the end of October, we have recorded about 7,400 cases, of which only 17 of them were locally acquired cases, meaning that about 83 of them were imported cases. But in terms of mortality rate, we can confirm that out of those 7,400 cases, we have lost about 66 lives. So meaning that malaria remains a serious death threat in the country, even though it's preventable and curable.
66 people have died of malaria in South Africa since the beginning of the year to the end of October?
That's correct.
That's a total number. That's quite a big chunk, yeah. So what progress then would you say we are making towards the 2030 goal of eradicating malaria? Remember, there's a number of visions or broad goals, like the United Nations Sustainable Development Goals, like our own National Development Plan, like Goodbye Malaria efforts.
Yeah, definitely. As the country, we're also a signatory to the campaign to end malaria in South Africa by 2030. Yes, we can confirm that in the past 5 years, we've seen a decline of about 84 cases of locally acquired malaria cases in the country. We've made a huge progress, but we still feel that a lot needs to be done. Hence, we had ensured that we intensify malaria awareness in the communities, not only during malaria seasons, which started between September and the end of March the following year, but it's this throughout the year campaign in order to ensure that we raise awareness about malaria, but also we intensify indoor residual spraying in the malaria high burden areas, especially in the provinces of Limpopo, KZN, Mpumalanga, and some parts of Gauteng. But also we've ensured that we continuously screen and test malaria at border gates, especially in these 3 provinces which border with Mpumalanga, Limpopo, and KZN, to ensure that people who are entering the country through these borders, they are screened and tested for malaria in order to detect malaria cases as early as possible and refer those who test positive to health facility for medical attention without any delay.
Yeah, you must be concerned, though, that since 2021, the numbers have been going up. You've mentioned the numbers. For example, in 2021, I think there were 56 deaths recorded. This year, up to October, it's 66 deaths. Where do you think is the biggest challenge? You are creating awareness, and you know which of the provinces you've got high incidence of malaria, like Limpopo and Mpumalanga. Should you, as government and working in partnership with other NGOs, like Goodbye Malaria, step up, for example, on the distribution of nets, or in terms of spraying in the villages and the affected areas?
Yeah, as I indicated, when I provided a number, I said about 83 of the cases that we recorded so far, they are imported cases, meaning that people who have traveled to other countries like Mozambique, Zimbabwe, and other neighboring countries. who were infected in those countries, but they were diagnosed when they crossed the border based on the travel history. So what we need to do is to intensify awareness to encourage all those who are traveling to and from malaria endemic countries or areas to ensure that they take a precautionary measure. But also we encourage people who experience malaria signs and symptoms not to waste time, but to present themselves to the nearest health facility. But for those who are traveling, we've got anti-malaria pill that they can get at our any nearest public clinic or travelers clinic or any pharmacy, which they can buy without prescription, so that they protect themselves. But also we encourage, especially the pregnant mothers and the children under the age of 5 years, to ensure that they avoid traveling to those malaria high areas unless they have taken precautionary measures in the form of this anti-malaria pill. So we appeal to all those who experience malaria signs and symptoms not to waste time, but to present themselves as early as possible.
Yeah, because sometimes you could think it's a heavy flu. Meanwhile, it's already malaria if you travel to that area. So get it tested. Thank you very much. Foster Mohale, speaking on behalf of the National Health Department on this Malaria Day.